Amanda Krasinski. I am the Executive Director of Helping Hands in Homecare. Currently we have 2 locations. One is in Michigan City, which is LaPorte County, Indiana, and the other one is in Valparaiso, which is in Porter County, Indiana, and we serve all the surrounding counties right now. We currently provide skilled nursing services, personal services, which is attendant and homemaking. We do beads services, which are developmentally disabled services to consumers, as well as music therapy. Music therapy is actually super neat. So the individuals come in here with a board-certified music therapist. Families, caregivers can sit out here. The client can't see them. So these are 2 treatment rooms here, and then they also do the treatment in the home. So the Medicaid waiver does reimburse for that. My husband and I opened the agency 4.5 years ago. It was a startup agency from ground up. My background is in home health management, and we just saw a great need for an honest, compassionate agency. And more seniors and people with disabilities are choosing to stay home, so it's nice to give people that option. So they can get all the same services at home that they would get in a facility or a hospital, so it's good. Back this way, we've got lots of offices here. We saw a very good need for an honest, compassionate agency. Giving people the option to not have to be in a hospital or facility. We had interviewed several different software companies before choosing Alora, and one of the things we liked about Alora is that it was so personalized and that you can call customer service 15 times a day if that's what you need to do. They're very open-minded. They try to make it fun. They will take suggestions and change the software based on your needs. The other nice thing about them is they were the ones that actually helped us start with billing. They have a lot of experience with billing and things like that, which obviously we all want to get paid. So that is good. They are quick to respond when you have any concerns or anything like that, and it's definitely a team company, which is important to us. Our director of music therapy.
Whoa.
He's a mess. So Noel's been with us how many years?
It's going to be 4 in April.
Yeah, so he actually started our music therapy department. He actually helped us.
Yeah.
We didn't know much about it. So the good thing about Alora is it's all encompassing. So you do your scheduling, you do your billing, you do all your documentation and everything through the software program. And they recently just launched Alora Plus, which is really great for nurses and things like that in the field for electronic documentation, which is going to be mandated in, I believe it's 2017. So it's excellent, and it's so good because you can access it from anywhere. They do have apps that you can put on tablets and phones and things like that. So it's a really good program. And then down this hallway, we've got our billing department, which is here, full of paper, of course. And we've got our marketing director in here, which does all our marketing. We initially realized that we needed a software program, so we started interviewing before we even officially opened. So when we opened, we had Alora from day one. Customer service people most definitely go above and beyond what they're required to do. Anytime we had a question about anything, they would help us, even if it wasn't exactly something that was, something that they were expected to do. So helpful to us would definitely be Melissa Jones. I believe it's Thomas now. Serena has been super helpful and on top of things. Anytime I have any questions, she is so quick to respond and pleasant, and it's just a really enjoyable experience. Anytime you have to get on the phone with somebody, you're never like, ugh, I have to call customer service. You maintain or start to get some sort of relationship with them, and it's just a really good system that you guys have set up. They are so great. They will do a go-to meeting right on your computer, and they can see what you're seeing. They're good at showing you how to add specific codes based on your needs, how to do billing. In fact, they'll walk you through it. I know we had some issues with billing denials. They will physically get on the phone with you and help you do that. I know that I've had many conference calls with Indiana Medicaid and one of the customer service representatives. It's just a really, really open and inviting customer service experience, and people are available the entire day. If you do send them an email, they're quick to get back to you, and you can get somebody on the phone very quickly. Currently, we have 220 employees between both of our offices. We have men and women. We have young staff as young as 18, and currently our oldest staff is 72. So we have everything in between. The staff work primarily in the individuals' homes, and Alora really is good at capturing what's happening as far as documentation goes. You can pull it up real time, so that's really helpful. Our goal as our agency is to see 5 locations open through the state of Indiana. Currently we're at 2, but I know with Alora and the way that you can make things work for each company, I know that that's going to be completely possible. It'll be good for me because I'll be able to see real-time, scheduling and patients and things like that. I can reference the communication logs and see where things are, which is good, so it makes my job a lot easier. I would recommend Alora to agencies that are startup as well as existing agencies, or people that are switching from paper to electronic. The switch is extremely easy. They will help you with every step of the way. They have a lot of experience with learning new things. If you're the first person in the state that they never have had to use the software with, for example, us, we were the first ones in Indiana that ever had used Alora, and they were the ones that 100% helped us with everything, helped us get up and going, helped us make billing codes and pay rates, and I spent so much time on the phone with Alora, and they never once made me feel bad for calling, so it's really good. I recommend it for any type of agency, no matter where you are. Either if you're a startup, if you're a franchise, an existing agency, there's just so much that you can do with Alora.